Hi, I'm Kelly Knupp, and I'm one of the pediatric epileptologists at the University of Colorado in Aurora, Colorado. I'm excited today to talk to you about cognition and autism in children with Dravet syndrome. I think, as we all know, this is something that is one of the signs and symptoms associated with Dravet syndrome. And so it's important for us to discuss it so that everybody is aware. Most children with Dravet syndrome have normal development until about 18 months of age. And this is particularly important for people to keep in mind when they're making an early diagnosis of Dravet syndrome, as we often think of it as associated with intellectual impairment, but this may not be present in early ages and should not interfere with making a diagnosis otherwise of Dravet syndrome. We do start to see intellectual disability emerge throughout the lifespan, and typically this is present by 3 years of age. And the separation between the intellectual ability of a child with Dravet syndrome and their peers tends to increase over time throughout the age span. We also see that a number of children have attention problems. This can present early in the preschool years and is particularly a problem throughout the school age years. Physicians and parents both agree in our consensus statement that treatment of these attention problems can be recommended. And also an important thing to keep in mind when we're looking at the overall care of a child with Dravet syndrome. We also recognize that we see depression and anxiety in children with Dravet syndrome, and this becomes particularly apparent with increasing age, particularly in the teenage years, the adult years, and is something that it's important for providers and for family members to try to assess, because this assessment can be somewhat challenging due to the limited ability to communicate that some children with Dravet syndrome have. We also can see regression. This can occur particularly after episodes of status and is something that we should be mindful of and assessing for after a child has had a prolonged episode of status epilepticus. One of the unique characteristics of children with Dravet syndrome is that we see social skills tend to be better preserved than communication skills. And many children, in fact, will receive a diagnosis of something called expressive aphasia, which means that their words, as they're trying to express them, are more limited compared to their understanding of language. This is particularly important for caregivers and teachers to be aware of, because often when we assess children for their academic skills, we ask them to express it in verbal means. And this can be very challenging because the children may have difficulty expressing the words to demonstrate the skills that they may know. So a very important thing to keep in mind. There are many factors that can impact intellectual impairment, and it's important for us to keep these in mind. Some of these are factors that we can avoid with the use of appropriate medications, and some of them are factors that are fixed and that we can't change. One of the factors is a diagnosis of Dravet syndrome at a young age. Also, the number of episodes of status epilepticus can lead to increased intellectual disability. A prolonged use of contraindicated medications has been associated with intellectual impairment, and as well as the delay in receiving optimal medications and treatment strategies. And so it's very important that we recognize this diagnosis early on so that we can provide the appropriate treatment for these children. The presence of absence and myoclonic seizures in the first year of life have been associated with increased risk of intellectual disability, as well as the presence of tonic seizures at any point in time in the lifespan. We also recognize that children who have abnormal EEGs with increased epileptiform discharges in the first year of life are at greater risk of having intellectual impairment than those who do not. And also children who have early motor delay are at risk of having intellectual impairment compared to children who have normal motor development early on in life. So these are important factors to keep in mind as we're assessing children, knowing that all children with Dravet syndrome are at risk for intellectual impairment and autism. But these children who have some of these factors, we need to pay particular close attention to make sure that we provide appropriate therapies and intervention. It's very important that we do assess children for intellectual impairment and autism so that we can provide appropriate support and therapies to families and children throughout the lifespan. I hope that you have found this helpful, and thank you very much for listening.